The highlights, the big accomplishments were working in the ICUs and saving patients' lives. That's the biggest thing, is helping the team give patients back to their families. I can't top that. When I was little, my mother told me that I would say I wanted to be a nurse and a mommy when I grew up. I went to the Birmingham Baptist Hospital School of Nursing. That was a 3-year diploma program. The fortunate thing is that Ms. Moffitt was smart enough to arrange with the University of Alabama for us to take our basic undergraduate courses as full credit from the University of Alabama. And so that meant that when I graduated with my diploma, I only had to go another year full-time and a year part-time to finish up my BS. Worked nights, worked evenings, went to school in the daytime to do that. And then I stayed out for a year to take care of my dad, who was ill and died. And then I went back to get my master's. During that year I was out, Dr. O'Corin called me, and I can remember the moment, and said, I know that you always wanted the cardiovascular role, and so we're starting a program, and I've enrolled you, and be here at this date, at this time, in this place. And I said, yes, ma'am. And I did. We were a new breed of animal there, and nobody knew what we were supposed to be doing, and nobody had ever seen a clinical nurse specialist before. A few people knew about it. Of course, my boss who hired me was all about doing new things. But on the unit, I felt like a wind-up doll, turn my switch and say, I'm a clinical nurse specialist. A clinical nurse specialist is. And I had my 30-second elevator speech to give everyone. One of the nurses in the CCU said, when they told us we were getting a clinical nurse specialist, I expected to see someone coming in a stiff starch white uniform with a cap and a clipboard and a checklist. And she said, the first time I saw you, you were carrying a dirty bedpan, and I thought, this is a woman I can work with. In my first year of being a clinical nurse specialist, we had a 42-year-old man in our unit who had a heart attack. And remember, back in these days, we didn't have, on community hospitals, we didn't have cath labs and all the procedures and things we did now. We just had to take care of them and pray that they lived. And he went into cardiac arrest. And I was the first one in the room, bringing the defibrillator with me. He had 6-year-old twin daughters. And we didn't know if Daddy was going to live or not. He had a temporary pacemaker, we had all the bells and whistles that we had at that time. So I had the mother bring the girls up because I didn't know if that was going to be the last time they might see him. So I sat the girls down and told them what they were going to see and what they were going to hear and what they could touch and what they couldn't and how they could hug Daddy. So they had their nice little visit. So 12 years later, I'm sitting back reading the newspaper. I opened the newspaper to the society column, and there he is in his tuxedo with his 2 beautiful girls on his arm for their debutante ball. And I just burst out crying with joy. Can hardly do it now, all these years later. And to know that we were able to give him back to his family. And he was able to see his little girls grow up. So that was one of the good things that happened. And there were a lot of those, just a lot of those. So that's the great accomplishment about being a nurse, is being able to save people's life, for heaven's sakes. How much better of a job can you get than that? Best job in the world.